I graduated from Washington University in St. Louis in 2006 with a OTD, and they were, I think, the only school in the country that had a work in industry specialization track. And I had the good fortune, of course, of working with you, Len, as my research mentor and graduate advisor. And after that, I got a job in a traditional severe residential brain injury clinic where we worked on ADLs and some IADLs and community mobility. And, uh, as I think most OTs learn that, one particular area might not be for you. And I decided I wasn't a great fit for me and my interests. And so I went back to WashU to work in their clinical community practice program, and specifically at a place called the Occupational Performance Center. I think you interviewed Deb Turley, and she was working there for many, many years. And I had the good fortune to work with her and learn a lot from her. And I was there 2 years working for primarily folks that had concussion issues returning to work, generally higher level jobs. And that was a much better fit with my graduate research and where my interests lied. And after that, I had the opportunity to go to Walter Reed Military Medical Center in DC and help start brain injury outpatient OT programming there. So incredible team of OTs, an incredible opportunity. They did not have outpatient TBI therapy at that point, so I was honored to be able to play a very, very small role in helping to build out some of the services at Walter Reed to serve the men and women coming back from Iraq and Afghanistan.
You may be downplaying your contributions there. In fact, you are. I visited you twice, and I was impressed with the creativity and leadership you were providing to that program. So say more about what you did there to get things rolling.
Well, the one of the things I've discovered in my career is that I really enjoy building programs, and whether that's doing it myself or facilitating others building their own programs or what have you. So when I got there, it was just me in that, and then through the assistance and hard work bureaucratically of the clinic leadership, I was able to. I think by the time we got done 4 years later, when I got done 4 years later, I think we had 8 or 10 or 12 FTE positions, whether they were government service or if they were contractors that the government paid for or contracted with rather. Um, and in our little department, we had OT, and in addition, we had therapeutic rec and assistive technology. We also ended up staffing the vision therapy component of the neuro-opto department for the Walter Reed folks, and that ended up, it's really important, I feel, to keep your eyes and ears and heart open in your profession, because you'll learn things. And one of the things I learned when I got to Walter Reed, I thought I was really interested in, the concussion and the return to duty, the return to community life, and facilitating, increased participation in family roles, the whole thing. But the two things that I thought that I didn't really think were important were vision therapy and assistive technology. And by the time I got out of there, I can be pretty obtuse, but even I could see the benefit of vision therapy and assistive technology. So we had one full-time vision therapist basically, and then we had two full-time assistive technology providers, which were key catalysts to the functioning of the clients that we worked with. So valuable, all kinds of valuable lessons for me, professionally and personally. Working with the military was a huge privilege and honor, big learning curve too, but they had patience with me and believed in me, and I did everything I could to ensure that their investment in me and their trust in me to start some programming was, I had a good return. And I think we did have a pretty good return. Mm-hmm.
So at Walter Reed, you were there for a little more than 4 years.
Yeah.
How many people did you see, and were they people who were going to go back into service or coming out of service, transitioning into civilian life? What kind of ratios are we talking about here?
We were just on the active duty side of the house. I'd say that 3/4 of the folks, yeah, that's a fair estimate probably. 3/4 of the folks were in the process of recovery and medical retirement.
Mm-hmm.
I would say that, and that could take up to 3 years sometimes if you had individuals that were dealing with really significant polytrauma.
Mm-hmm.
The other 25% were folks that had been injured in some way in the line of duty, or just in their civilian lives as stateside or garrison staffed service members across all branches, and were needing to stay at work. And so the military had an investment in trying to help them stay. So we did a lot of
Mm-hmm.
return to work for folks at the Pentagon, War College, places like that, as well as
Mm-hmm.
just your average Joes out there that maybe got in a car accident or had a concussion playing contact sports, basketball or football or whatever.
Mm-hmm.
Or there's a lot of training injuries in the military because you got to train how you fight. And so you get banged around pretty good sometimes.
Mm-hmm. Okay. Well, thanks for explaining that. What did you do after Walter Reed?
I had the opportunity to become a consultant for the Department of Defense and leverage some of my experience to help other brain injury and psychological health programs evaluate themselves on how effective they were in terms of outcomes and effectiveness. And then also the part I really loved was then follow-on development support for those programs. So helping the programs identify what their needs were, and that could range from everything from the financial effectiveness of what they were doing to the clinical effectiveness of what they were doing to staff satisfaction outcomes for retention purposes. And then working with a team of PhDs that I led to figure out how we can help them develop in their settings in their own facilities. And we were all over the world. I had the opportunity to go to Japan and Germany and all over the U.S. So I did that for about 4 years.
And that built on the experiences and expertise you had developed at Walter Reed in the prior 4.5 years.
Absolutely, absolutely. Without, I mean, it's tough to be a consultant in anything if you haven't actually lived the life that you're consulting about.
Yeah.
And so my I certainly didn't have the academic or the statistical or the research pedigree of a lot of the people on the team that I would lead, but the I had the clinical expertise. I had my chops, and I knew what it was like to work 60, 70 hours a week for years at a time,
Mm-hmm.
to do your very best within complex systems, and to kind of be at a loss of how do I know what I need to do, but I don't know how to do it in terms of developing effectiveness and identifying outcomes and
Mm-hmm.
that sort of stuff. So I think that's why I was chosen, not of any, not because of any particular competence, but because I did have a lot of kind of in the trenches experience, if you will, for the types of psych health and brain injury programs for rehab that we were working with.